Hello, everyone. My name is Alison Cebulla,
And I'm Twombly.
and welcome to Healing Horizons. And so, this is where, let me introduce you to Tend Collective. We're consultants at Tend Collective. And at Tend Collective, we're creating a world where people genuinely care for one another. And your organization can hire us to implement trauma-informed care and psychological safety-based programs and policies to better care for your employees and in turn for the communities that you serve.
So each week on what we are calling Healing Horizons, we are going to share some of the latest news as well as research in trauma-informed care, positive and adverse childhood experiences, and psychological safety. So I'm going to hand it over to Alison to get us started for today.
Awesome. So today is Thursday, April 4th, 2024. And just a heads up, we will be talking about trauma, and sometimes that involves violence. So we just put together a list of things that have been in the news the last week or so related to trauma-informed care, adverse childhood experiences, positive childhood experiences, psychological safety, so that you could get an idea of which programs and policies are happening out there in the world. Maybe it inspires you and the work that you're doing at your organization, or maybe gives you a little bit of hope that these interventions are moving forward. So we're going to highlight a few that we saw, as well as some of the latest research in this area. So to start us off, there was some news from the Chicago Department of Public Health, and this is pretty exciting. It's a collaborative for a trauma-informed Chicago is a new transformational initiative funded by the Department of Public Health's Office of Violence Prevention, and they're going to build they have a long commitment, long-term program for trauma-informed practices in the city of Chicago. So this is really exciting news. Very curious to see what will come out of this. What I like about it is that it's a cross-sector collaboration among different organizations and initiatives. And the goal is that they want Chicagoans to feel safe and to heal and to be able to thrive in a city that is working together to prevent and address the impacts of interpersonal, generational, and systems harm caused by structural racism and trauma. I really like the holistic sound of this initiative. I really like that the Department of Public Health is involved. Having done a master's in public health myself, this is such a nice, well-rounded, and holistic discipline that tends to take into account upstream solutions and cross-sector collaboration. So it's always nice to see that. I'm really curious to see how the trainings, it looks like it's going to be primarily like trainings, events, advocacy, and some research. I'll be really curious to know like who gets the trainings and in what context, like where will they hear about them, or where, like, will it be at family resource centers? That's traditionally, I think, what we're seeing across the United States is that these trainings are being done at centers that serve parents. Sometimes that can be a limitation. Like we'd like to see these trainings happen like within the Department of Public Health, for example, or within the Department of Social Services. So I'll be curious to see what they end up doing. So another piece of news is that Kentucky. So this was a piece of news from March 11th. There's a new bill in Kentucky that would strengthen trauma-informed services in schools. This one I'm a little curious about. I would love to know the backstory as to how they chose this particular intervention. Like, was there a literature review done? Did they review everything and decide that this was the best possible thing? Because the article says this is a trauma-informed intervention. When you kind of dig into the nuts and bolts of what's in there, it has to do with having these guardian roles in K through 12 schools, which I think are supposed to be like a safe adult that a student could share something with, like if they're having suicidal ideation. And I I'm really curious about guardian programs. If they've been successful in other states, this would be something that I would have to do more research on. But when I see a piece of news like this, that's like the question that comes into my head is this an evidence-based intervention? And certainly we're excited to see people in Kentucky thinking about trauma-informed services. But I am very curious as to how they decided upon this one. So, okay, right nearby in the city of Cincinnati, this piece of news came out just a few days ago on April 1st. And there is a coalition of community and medical leaders that are pushing for systemic change in Cincinnati to addressing and preventing trauma. We love to see the word preventing. It's not enough to treat it or screen for it. Let's prevent it. And so the goal is to address root causes of trauma to better manage its impact and improve equity. And so they're looking for a cultural shift within the city for how leaders approach trauma. We love to hear that leaders are involved and that the cultural shift needs to come from leadership. Because that can often be a huge barrier to change. And oftentimes when leaders understand the impacts of trauma, they can make and implement better programs and policies. So they're kind of looking to Baltimore, who passed a Healing Cities initiative a few years back, and maybe hoping to replicate this model. A city council member named Zeke Cohen said, city leaders spend way too much time thinking about how to better police us when you should be thinking about how to prevent trauma from occurring in our lives in the first place. That's the kind of thinking that we love. And so the Healing City Act, which made Baltimore a Healing Cities initiative, mandates that city agencies be trained in trauma-informed care. And so the questions that pop up for me is, how consistent will that training be? If there's employee turnover, are the new employees also getting that training? Is this a long-term program, or is it more just like a couple up front and people are not getting that later? As we know, there's a lot of turnover in social services. So those are the questions that pop up in my mind when I hear about interventions like this. What is the plan for sustainability? Another idea for Cincinnati is to implement a dashboard, an opportunity and equity dashboard that looks at public data that focuses on health, homeownership, educational outcomes, and other pieces, just to get a nice snapshot of what's going on in the city so that you can actually then address the various issues.
Awesome. Thanks, Allison. And I think just hearing you talk, thinking about like systemic and policy change, and I think there's like a thread that goes through a lot of what we're talking about today of like the need for this like systemic change and things through policy to happen as well, to really kind of change what's going on in our country and the experiences that people are happening. So I want to start by highlighting the Healthy Outcomes from Positive Experiences, or HOPE for short. Their resource center, which is part of Tufts Medical Center, held their 4th annual summit a few weeks ago. So if you happen to register for that, I just want to remind you that you have access to all of those session recordings. And historically, they have made recordings of all of the sessions available to the general public later on in the year. So I would kind of maybe go check out their website, sign up for their newsletters, those types of things, so you can be alerted when those come up, because there are some really great sessions that happen every single year. So just a little bit about kind of HOPE, because that will inform kind of what I'm talking about a little bit, is they developed what they call the 4 building blocks of HOPE. And that's based on research on positive childhood experiences. So those are relationships, safe, equitable, and stable environments, social and civic engagement, and emotional growth. And why we want to talk about positive childhood experiences and think about them is because they're really important, because they help to buffer against the impact or the development of toxic stress that people can end up developing from experiencing kind of chronic trauma. So a lot of the keynotes there, as well as the kind of breakout sessions, discuss that need for systemic change. And we need that systemic change, again, to reduce re-traumatization for people and to help to create more healthy and equitable systems. I want to highlight one of the keynotes. So in this keynote, Leonard Burton, who is the president of the Center for the Study of Social Policy, he talked about the need to transform early childhood care using anti-racist policies and practices. There was a quote that really struck out to me in his talk. He said, "Systems need to undertake a fundamental shift from gatekeepers, where you have this social control and enjoy that social control, to gate breakers and opportunity openers, creating space and opportunities for people to thrive." So I really, really just loved everything that was in that chunk of quote, because systems or programs often end up creating things with good intentions a lot of the time, but they end up telling people what they can and cannot do. They require a lot of hoops for people to jump through to be able to get enrolled in program. And they also give the provider and the systems the power, as well as that appearance that the provider or the system knows best, and that some people are worthy of having their needs met and others aren't.
Mm-hmm.
But when in reality, really, families and individuals, they're the experts of their lives. They know what is best for themselves and for their families, and they should be the ones who have that power to be able to make those decisions. And a great example to really highlight that he talked about was the child tax credit increase that happened in 2021, and how that provided families with financial support to help to raise their family. This program was really unique, and it gave people the money. It didn't tell them how to spend the money. Rather, it gave families flexibility, autonomy, and freedom to be able to spend the money in the way that kind of best met the family's needs, which helped to remove barriers. It helped to alleviate stress for families. And another good quote from this keynote was that it allowed them to parent as they'd like to parent. And that quote was actually from a parent in the program. And I really like the building blocks of hope. It gives me a lot to think about. It gives me different ways to think about how to use them. And often they are really used with children and families, but they're really good to think about in terms of leadership development, supervision practices, and building caring communities within workplaces. So when we think about things like flexible work schedules, paid parental leave, livable wages, all of those things align with the building blocks of hope. So I was just really excited to kind of attend the sessions that I attended during that, and to be able to watch some of the recorded sessions that I wasn't able to attend, just to continue to learn more about the interventions, about people who are taking that and putting it into practice, and doing other research on positive childhood experiences. And positive childhood experiences will be another thing that you'll see is like a thread in what we're talking about today. I think our other news is in the area of psychological safety. And so there was a recent podcast that was hosted by Gallup and Clifton Strengths that talked about building psychological safety within your team. And they really used, and one of the speakers was from Australia and was really able to talk about the work that they're doing in Australia related to psychological safety. And in Australia, psychological safety has been elevated to be as important as physical safety.
That's so good.
So, yeah. So I was like, yes.
Wow.
And so just really like exciting and interesting to hear about kind of what's going on in Australia specific to psychological safety. And kind of the panelists talked about how kind of lack of psychological safety can show up in the workplace through things like lack of role clarity, job demands being too heavy, having poor support from managers of the organization, unfair work practices, poor organizational change management. So many of the things that I feel like we're hearing from those in the like American workforce right now, and probably world workforce, of just different things that are making people feel burnt out. It's impacting people's mental health. And so just really important to think about, and that importance of psychological safety. They also shared what they called quick connections as a tool to support psychological safety, which they described as short opportunities to check in with employees around 3 different things. So those 3 things are, how are they doing? So how is that person doing as an individual? Like outside of work, just like,
It's
how's this
amazing
human
how
being?
it just doesn't happen. Like, it
No,
just, no, I don't know. It's
no.
so simple. Yeah.
Yep, yep. So, like, how are you doing as a person? What is going on in your life? What is on your mind? Just being able to engage in that relationship, in that way as if they are an actual human being, who matters. Also asking them how work is going and what support they may need. So not expecting for them to come to you all the time, with those questions, or like, I need some support, but proactively checking in on how things are going. Are there barriers? Are there things getting in the way? What may I be able to do to kind of help to support that and to move that ahead? So that helps to alleviate some stress for people. And these quick connections can really be used as tools to do things like increase engagement, performance, and psychological safety. And these strategies are really important because bullying and harassment, unfortunately, are really common in a lot of workplaces right now. So if we're not checking in on these things, we're not creating psychologically safe work environments, those are going to continue. But when we have these opportunities, when we're building the psychological safety, we increase engagement and we decrease bullying and harassment, which ultimately results in healthier, more caring workplaces for people. So I really just loved some of the examples that they gave of what looks like an unpsychologically safe workplace. And here's an intervention that you can take right now, and go try. And of course, when you think about that, you want to make sure that you're doing it in an authentic way, right? Because it's a lot about that relationship piece. So if you're just going in as a checklist, if I ask these 3 questions, that's not going to create that psychological safety. We want to really be creating that genuine relationship, to be curious, to have that empathy for people. So all of those important skills as well. The other piece of kind of news related to psychological safety was that there was a kind of paper release called the Beyond Workplace Wellbeing Framework. And that was out of the Department for Psychological and Behavioral Sciences at the London School of Economics and Political Science. And really what they did is they looked across the United Kingdom. It was a really large qualitative study that they did, and they were really looking at workplace initiatives related to well-being. And they were finding that as individuals, we all want different things related to our well-being. So if an organization is saying, here's a meditation day, or here's bagels for breakfast, that may feel good for one person, but it may not feel great for another person. It may not be what they need. And instead of really focusing on well-being, the focus should be on creating psychological safety. That is the thing that's going to keep people working there, that's going to help people feel safe, that's really going to support their mental health, and helps to reduce those things that can cause what they called ill-being. So those things like bullying and harassment, not feeling valued, all of those types of things. They also specifically mentioned being able to give employees autonomy of how and when they work. So again, that's been like a big discussion, especially since COVID, just around what does autonomy look like? Do you need to be in the office? Can you be out of the office? Do you need to work 40 hours? Or are you getting your job done? Like, what do all of those things look like? So just a really good, I think, kind of conversation starter and paper around, let's stop doing these short term kind of interventions around well-being, and let's think of this long term, that creation of psychological safety that helps to retain employees and really help
No
them
more
to feel
pizza
valued.
parties?
No more pizza parties. Or we can do pizza parties. Sometimes pizza parties can still be good, but we don't
Yeah.
just want a pizza party once a year is not doing it when we're getting bullied
Right.
in our team meeting.
Right.
So yeah. Yep.
Um, Great. It's always good to know that someone out there, even if it's not here in the United States, is asking the hard questions around psychological safety. Although another piece of news is that the Workplace Psychological Safety Act that was introduced in Massachusetts, has not passed yet, has also now been introduced in Rhode Island. So that is great. You can follow them on LinkedIn and go to their website to learn how to put that in motion in your state. They have a toolkit for that. So we really think that will be a great thing to have protections for employees.
Absolutely.
Yeah. So we are now going to talk about peer-reviewed research that has come out in these areas. So we have a few to share today. Of course, there are so many, so we're just highlighting a few. So this is a study that came out in the Journal of Child Abuse and Neglect, the February 2024 issue, by a group from the University of Calgary in the Department of Psychiatry. And the title is Routine Screening for Adverse Childhood Experiences, ACEs, Still Doesn't Make Sense. And this is a juicy one. This juicy. Yeah, it really is. We actually were talking about maybe we want to do a whole webinar just on the ideas presented in this paper because it's really, really important to make sure that we're being critical. Hopefully, the ACEs Aware and other ACEs screening programs will end up being great interventions that do a lot of good. However, we don't know that still. And so it's really, really important to ask critical questions and to make sure that these programs are being evaluated and to think through some of the biases. So this paper does an amazing job of highlighting all of the things that we need to be critically thinking about before we implement screening interventions. So a few highlights, just being that they're really calling for randomized control trials. So this would be where they have a population of patients who've consented to be a part of the study that some of them are receiving the ACEs screening and some of them are not. And then it's random as to, whether they know which part of maybe the intervention that they're getting. And this is really kind of the gold standard in research in a lot of ways. They mention in this paper that's not often used for psychosocial interventions, but it has been. And so there is precedent on how to create a study like this. So they cited that there have been studies in the past on screening for intimate partner violence. And so they did 3 randomized control trials of intimate partner violence screening in 3 countries, the United States, New Zealand, and Canada, and found that none of these studies found significant positive outcomes for the screened population. And of course, there's a whole discussion that could be said as to why that is. Many, many, many reasons. Perhaps they were not given the resources, or when it comes to intimate partner violence, this is actually well known to be something that's very, very hard to turn around. Actually known in public health as being something that's once someone has gotten into a dynamic a little bit where they're used to having this sort of violence in their relationships, it can be very hard to turn that around on an individual level. So screening may not actually help. So this is a nice precedent to look at. A similar study could be designed for adverse childhood experiences screening. And since we know that it wasn't effective with this other intervention, would be really good to make sure that we're doing that for this one. So they also mentioned the potential harm from psychosocial interventions, that there is a pattern of higher rates of antisocial behavior among some youth exposed to group-based interventions under certain conditions, with peer deviancy training being one of the identified mechanisms. So again, it's a really big topic, but I think it's really important to understand that not all psychosocial interventions are proven to be safe and effective. So there can be harms from we'll have to do a webinar.
It's a lot to unpack. It's a lot.
There's so much to unpack. Yeah. But they did mention the risk of attributional bias. And so this might occur when a given condition is attributed to adverse childhood experiences exposure yet the condition may not be a function of adverse childhood experiences. And again, there's a lot of nuance there, but it's important to understand that attributional bias exists, and you may be, it makes me think of like false past memories. Remember when that was like a whole thing of like remember this repressed memory, and then it turned out like it wasn't real. So these are when it comes to psychosocial interventions, there's just so many different ways that the brain works that are just wild. And so it can be a tough type of intervention to put into place. And so if you're telling people this may be because of trauma, it could be kind of equivalent to almost like planting a false memory. So another potential risk of harm is that you might be labeling someone as at risk as a result of the screening, which is stigmatizing and may have negative mental health outcomes as a result of being labeled at risk for individuals. And then another really huge piece is that resources are limited when it comes to what we can put into place for health interventions. And so when you're allocating money in one area, typically it means you probably don't get to put it in another area. So do we know that this is the very best intervention to use with the money and resources that are available? And so it's really important that all of this be considered, given that you could actually allocate the resources in another way that could be more effective. So again, that honestly barely scratched the surface of this piece, and we'll put the links to all of these in a blog that we'll link here so that you can find them all. But that one is just so important. Not to I probably just didn't note that, but also just certain groups being more targeted than others, such as by race. So there's so many things to think about when it comes to screening. So another study published in the Journal of Addictive Behaviors in their May 2024 issue. This was a meta-analysis of tobacco use behavior among adults exposed to cumulative adverse childhood experiences. So a meta-analysis is when they look at all the studies, because each study has its own limitations and biases. So when you find a meta-analysis, this is really great because researchers are looking at what is everyone agreeing on pretty much, or what is the consensus based on all of these studies, like what can we all agree on? And so this is really what you want to look for, especially if you're making a trauma-informed program or policy at your organization or your agency. You're going to want to reference these meta-analyses and systematic reviews more than just one-off studies. So they looked at 42 studies, which is kind of amazing, with a totaling a population of over 600,000 participants in cohort and cross-sectional study design. And so I feel that this one is very intuitive, but it's still always nice to just know that someone reviewed the literature and it is still the case that adverse childhood experiences leads to X, Y, and Z health outcomes. So we can imagine that if you had a lot of stress in childhood, that you may be inclined to be a smoker in adulthood or in your teenage years. So this is the consensus. 4 or more adverse childhood experiences. If the population they looked at had that exposure of 4 or more, this increased the odds of current tobacco use, initiation, former use, nicotine dependence, and the use of e-cigarettes. And so people with 4 or more ACEs, and there's 10. So people with 4 or more were twice as likely to have ever used tobacco and nearly 4 times as likely to be current tobacco users than those without ACEs.
So interesting. And it's so hard to not dive really deep into the first study. Like we could just
first study, we're just going to have to do a webinar. Yeah, yeah.
And there are some other studies out there that are like aligned with that. So Yeah, we will have to put together a webinar to go into
Yeah.
that a little
Yeah.
more
I
for
know
sure.
Danielle will want to be in on that one too. Yeah.
Yes,
Yeah.
yes. So I am going to kind of wrap up our peer-reviewed section now with a few different studies that I found and wanted to kind of bring and highlight today. So the first is from the January 2024 issue of Adversity in Resilient Science. And the authors of this study were looking at positive childhood experiences and recognizing that there isn't necessarily one tool that exists to measure positive childhood experiences. It's a newer area of research, a really important area of research. And we don't really necessarily have consensus related to tools. What should we kind of be using if we're trying to measure that? So they've reviewed different research studies that existed that were talking about how they measure positive childhood experiences. And their findings showed that there were numerous measures that existed. Some measures are validated, some measures were not validated, they were maybe modified. Based on research or other kind of models or frameworks that were out there. And they really recommended, based on the findings of this, that in order to really help us to kind of interpret the results and understand them, kind of to Alison's point of kind of when we can take all kinds of studies and look at them and have that large, what are those consistent things? If we're wanting to do that, we need some consistent tools to be able to take a look at that, as well as to make policy recommendations. So when we're making policy recommendations, when we have those larger numbers, again, when we have that consistency, that's more impactful. So they really recommended moving toward a consistent tool to measure positive childhood experiences. They didn't endorse any specific tool within that. So I'm interested to kind of continue to see where this goes, if there's any movement based on this research study, if we do start to see some consistency in what that can look like. Because I think there's some pros and cons to having a standardized tool that looks at things we're thinking about positive experiences as well as adverse childhood experiences.
And it's just always so nice to know that we're focused on positive childhood experiences and really moving forward with that. Like
Mhm.
what can we put in, to take care of kids? It's just so good.
Yeah, and I think because it's newer research, but the science is in research behind it is so amazing. Like it helps to like buffer against the impact of adverse childhood experiences. So in my mind, like yes, it's still important to talk about trauma, to like know what that is, but when we're really talking with families and when we're in communities and when we're talking with one another, like those positive things, like how do we create and foster and strengthen those are the things that I really am hoping we can continue to kind of move the conversation more in that direction.
And there have been so many studies. There's like a Center for Compassion Research at Stanford, but so much about like the power of gratitude. And I think when we can really focus on and call upon like the things that really worked well for us, that's just so good for our mental health.
Yeah, absolutely. And the next study that I'm talking about is also positive childhood experiences, like related, and it's talking about the impact that it can have for kind of mental health conditions and diagnoses. So perfect segue into that. So thanks for that, Allison.
Yeah.
So this study is from January of 2024, and it was published in the International Journal of Child Abuse and Neglect. And it was a study in British Columbia. There were 8,864 adolescents ages 16 to 17 that participated in the study. And each participant was asked to provide an ACE score from 0 to 4. So they didn't have to endorse any ACEs, and they didn't have to say if their score was higher than 4, because all of the research related to ACEs is if it's 4 or higher, it doesn't matter. There's the same kind of dose response relationship
Right.
that's shown. So they didn't need to endorse anything higher than 4. They also were asked to complete the child and youth resilience measure, which is one of those tools that is used to measure positive childhood experiences. And then they were also asked to complete validated scales for depression, anxiety, and overall mental well-being. The study found that adolescents with zero ACEs, zero reported ACEs, had significantly better mental health and well-being than those with one or more ACE. So that's a lot of what we've already seen kind of from the original study and like over years related to ACEs. They also found that having 6 or more positive childhood experiences was associated with better mental health and well-being in adolescents with and without ACEs. So again, there's that power of having those positive childhood experiences, and the more a person has, the better it is for their overall functioning in mental health. So the study really helped to show that positive childhood experiences can protect against depression among adolescents with ACEs, as well as to kind of help promote mental health and well-being among all adolescents who participated in the study. And a piece that I forgot to mention at the beginning is this was really looking at kind of the impact of the pandemic, like specific to adolescents. So those who have been adolescents during kind of the height of the pandemic. And these findings really help to emphasize the importance of addressing social determinants of mental health in order to help to mitigate and buffer against the impact of ACEs. And as we were just kind of talking about, really thinking about how are we promoting positive childhood experiences as part of a public health approach to mental health, especially for children, but also thinking about for adults as well, because we can use them too. There was a special collection of trauma-informed healthcare that was just released by the Permanent Day Journal. And there are lots and lots of different articles in there that are really interesting and worth kind of taking a look at. But I really wanted to highlight one that I found really interesting. This study was originally published within the Permanent Day Journal in October of 2023. And this study looked at healthcare trainees and how they were discussing ACEs and health with adult patients, specifically looking at the use of metaphor to talk about ACEs and the impact on health, which I found interesting because I have talked about ACEs and the impact that stress and trauma can have on our brain with metaphors for years. So I was like, oh, there's research on like if this is helpful or not. So I was excited kind of from that lens to take a look at it too. And what they did is they used videotaped sessions from the trainees, and they discovered that there were 24 different metaphors that were used by the trainees when they were talking with patients. It found that the metaphors may be really efficient and effective tools for discussing ACEs, as they can help to improve kind of clinician communication as well as patient understanding. They didn't find that there was any one metaphor that was kind of better than any of the others. With that, and they also talked about how it can really be helpful because sometimes we have like, here's the one way to talk about it, or here's the one thing. And that isn't the most accessible or doesn't necessarily click for everyone. And so this was talking about how it allowed the trainees to use different metaphors depending on the family, depending on what the family's needs were. And that helped them to be able to communicate more effectively rather than kind of requiring a specific metaphor to talk about that. So I really liked that it wasn't emphasizing there's one right way to do it, like we can do sometimes with that. And then the last study that I wanted to bring up today, that's kind of the end of our kind of news and peer-reviewed research, is that in the news this week, there kind of been the results of a study out of the University of Georgia, where there were 504 Black men from rural Georgia who participated in some surveys to see if there was an association between experiencing early adversity, specifically exposure to racism, and reports of suicidal ideation as an adult. The study also was really curious to see if there were changes in thinking that occurred for these men as a result of experiencing trauma, and if that was what was contributing to their suicidal ideation. So the study found that 1 in 3 Black men living in rural America reported experiencing suicidal thoughts. And researchers really found that people who grew up in under-resourced and who faced racial discrimination as children and into young adulthood were more likely to feel mistrust or isolation in social relationships, leading to suicidal thoughts.
Mm.
So there were kind of two main takeaways that I got from kind of reading this study when I think about why this matters to me, why this matters when we're thinking about kind of systemic change and creating more healing communities. Is that it really showed, again, how experiencing systemic trauma, this example, really racism, from a young age can have lasting impacts on people's thoughts and behaviors. Sometimes we really think about trauma as like an individual experience, something that may have happened. And there's a lot of systemic trauma that's out there, and it's important for us to be talking about that, for thinking about it, for considering how our organizations may be contributing to systemic trauma. As well, and how we want to be having those conversations with families as well. And also thinking about having conversations with families about how trauma has the potential to change how we're thinking about things. So it can make it so maybe our thoughts are not as positive, that we're not having a hopeful view of ourselves, of others, of the world. And how are we talking about that and considering that when we are kind of partnering with individuals and families? The other thing that it really highlighted for me was the need for interventions that, again, promote those positive childhood experiences. So when we're thinking about having healthy relationships, when we have safe and equitable environments, when people have connections with the community, that helps to really strengthen a sense of belonging. It helps to increase self-worth and self-esteem. Again, it buffers against some of those impacts if there is that kind of adverse experiences that they're having as childhood, that can change how we are wiring our brain. So maybe instead of developing those more kind of unhelpful negative thoughts, we continue to feel like, no, like maybe a bad, scary thing happened to me, but I am still worthy. The world isn't necessarily a bad place. It's not like a scary place, because trauma can really make us believe otherwise. So yeah, again, this power of positive childhood experiences.
Yes, that is a good theme. Wow. Thanks for summarizing all of those. Such good stuff to dive into. I'm like, I want to I want to talk deep dive on these. We're going to have to do some webinars. Yeah. So one thing that we offer at 10 Collective is literature reviews to support grant applications and grant writing based on the best evidence in these fields. So if your organization needs some help compiling a literature review so that you can design an intervention, apply for funding, evaluate an intervention, we can help with that. So, we review the research every week, and we've been doing this for a long time. So we can make a really great case as to why you may want funding for such a program, or as to why you might want to build a program a certain way. So please reach out to us. Our website is tend-collective.com. You can also reach out to us here on LinkedIn. Thank you so much for tuning in to our very first Healing Horizons news segment. And we are so grateful that you are here to watch with us, and we will see you next week.
Thanks for joining, everyone.